Welcome to the Abstract Blood Type Wellness Podcast, where the right play meets purpose and flavor finds faith.
Blood type balance, mind, body, whole. Feed your spirit, that's the ultimate goal. We season for life, body.
Greetings and welcome back to the Abstract Blood Type Wellness Podcast. I am your host, AC Price, certified wellness nutrition coach and educator, and founder of the AC Art of Food. And I'm super glad that you're here with me for this week's episode. Episode 10, When Policy Changes Your Plate, Heart Health, SNAP, and Finding Opportunity. So today's conversation is especially important, primarily because it sits at the intersection, of health, policy, access, and personal choice. So we're talking about the recent SNAP benefit changes here in Georgia and how they impact real people and how we can move from frustration, which it causes, to empowerment, especially when it comes to heart health. So we're absolutely going to take the science behind the simplicity of this all. And so before we go any further, we're going to ground today's conversation in a bit of research. So according to the National Institutes of Health, diets in ultra-processed foods, added sugars, excess sodium, and sugary beverages significantly increase the risk of cardiovascular disease, type 2 diabetes, chronic inflammation, and just a whole host of other disease in the body. Okay. And so research from the Harvard T.H School of Public Health also is showing that heart health actually improves most consistently when meals emphasize vegetables, fruits, fiber-rich carbohydrates. We're talking about those complex carbohydrates, healthy fats, and appropriately portioned proteins. So essentially, in short, what we eat most often matters, especially for the heart. Okay, so now let's layer this in, with something that often gets overlooked in a lot of public health conversations: individuality, because everybody's not the same. Heart health is not one size fits all. And blood type wellness helps us to understand why certain foods support one person's heart better than another's. So at the high level of it all, here's what each blood type should prioritize for heart health. Starting with my originals, the type O's: lean, clean proteins, anti-inflammatory vegetables, healthy fats like olive oil, and limiting overly processed grains. Now, for my type A's, we're the vegetarian, so it's the plant-forward meals at all times, High fiber vegetables, gentle proteins, and stress-reducing foods that support circulation over the whole body. Now, my blood type B's, B is for balance. Balancing moderate protein, supportive carbohydrates, leafy greens, and avoiding extremes. And then last but definitely not least, the ABs, with lighter meals, seafood, and plant proteins. And when I say seafood, I'm talking about like a nice cod, trout, salmon, and antioxidant-rich vegetables and sodium awareness. And all of this matters because heart health is not just about cholesterol, because we often think that when, it's cholesterol surrounding the heart, but it's actually about inflammation, digestion, stress, and sustainability. And that inflammation, that is playing a huge part, more than people really think. And that's going to bring us to today's policy discussion. The SNAP changes in Georgia, how health goes versus the human reality. So here in Georgia, new SNAP restrictions under the Act of 2026 are limiting the purchase of foods and beverages that contribute to poor health outcomes. That doesn't sound like a bad thing, right? So from a wellness standpoint, the intention makes complete sense. Like, why? I think it's great that if the government is going to provide foodstuffs for individuals, that it need not be laden with yellow number 5 and red 40 and all these artificial ingredients and things you would want it to benefit those with healthier foods. And I think until recently, more healthier foods were even allowed to be purchased with government funds for those that were in need, right? So it makes perfect sense. Absolutely. But from a human standpoint, it can feel a little uncomfortable because we're thinking of when government policy starts dictating the food choices in my house, right? It can feel like a control mechanism rather than care. So even though it's a good thing, it's just like, wait a minute. So we hear restriction and I'm like, oh my gosh, right? But this episode is not about judgment. We're not, saying either way, but we're just going to reframe some things. So here's a bit of what changed in 2026. Just a quick recap, okay? So according to reports, the benefits in Georgia now restrict carbonated soft drinks, and this also includes diet drinks, okay? No more of the 0 calorie. No, that is gone. Artificially sweetened beverages, candy and sugar-based confections, those energy drinks like Red Bull and other stimulant drinks, juices with less than 50% real fruit or vegetable content, okay? Packaged desserts with more than 10 grams of added sugar, and then the made-to-order beverages and foods from retail counters, kind of like your coffee shops and things like that. So about 1.4 million Georgians, and that's about 1 in 8 residents, will be affected. And that is significant. It's super significant. So this is how we can look at it and kind of flip the narrative from not so much restriction, but where's the opportunity in it? So instead of focusing on what is being removed, I want to introduce how we can focus a little bit more on what's actually been made possible. So this shift, just think about it. The shift is going to open the door to these 1.4 million Georgians, the 1 out of 8 residents, to reduced sugar intake, improved heart health, better hydration, and more whole foods in the home. And most importantly, the education about it, right? Because health sticks when people understand why they're making choices, not when they feel forced. So if the only thing that they're going to be able to get are these more health-focused foods, the labels will be read, right? Like, what's in this? So it's gonna make it more top of mind. People will be more cognizant of what they have to shop for and what they're getting. And with these things, you got to get creative. So the taste will be better, less processed, less laden with that sugar, but it will take adjusting, especially if that is the main thing that is purchased, say, like on a weekly basis in these households. So let's flip the script, and instead of focusing on what's gone, let's talk about what's still very much available and what's better for the body. So instead of soda and the energy drinks, you can try infused water. Slice up some lemon, cucumber, frozen berries, toss in there. Unsweetened iced herbal teas. Sparkling water with a splash of 100% juice. Instead of candy and packaged desserts, think fresh fruit or frozen fruit, often less expensive and is just as nutritious. Then homemade oat-based treats with minimal added sugar. Get in the kitchen, make the things with whole ingredients that you can actually control. And instead of the sugary drinks and juices, opt out for 100% fruit or vegetable juice and dilute it with a little bit of water. Not only does it curb that sugar, but it also stretches it. Okay. And then like whole fruits and vegetables, fiber matters. Juice is great for, to quench your thirst, and it is 100% juice. But when you remove or extract the fiber from the actual whole fruits and vegetables, that's when you get into like glycemic trouble. So it's best to, if you're going to do something, do a smoothie, but what's better than all of it together is the actual whole fruit and vegetable that you can consume in and of itself. And then instead of your coffee shop drinks, think brewed coffee or tea at home. Let me tell you something. Brewing coffee at home, the smell is unmatched. Like there's even candles for it. It's amazing. So that is the best smelling thing in the world. And then you get to control the sugar or the creamer or whatever that you're going to have added to it. If you don't prefer it black. Some people do. I am a preferred black coffee drinker. And try some DIY smoothies using that frozen fruit, greens, and water. So making your own at home gives you cost savings as well as control over what and how much you put into what you're consuming. You're in control of it. Okay. And then these swaps are going to save money and improve your energy and digestion and mood all around. Okay. So this is where blood type wellness helps with all of this. It's actually the personalization of it. And blood type wellness is going to help people to choose foods that digest well for their body, reduce inflammation without restriction. They can feel empowered and not controlled because it isn't about compliance. It's about alignment. And just to reiterate, the whole point of being able to focus on foods that are actually beneficial for your body, that is what the blood type wellness is all about. It's about a plant-based start. So you're going to start with your fruits and vegetables anyway. And this is a great way and a great opportunity to where it expands to allow people the opportunity to consume things that are of higher quality. Okay. So now, before we wrap up, it's time for the Great Eats, which is just a simple budget-friendly meal idea that you can try this week. And it's adapted by blood type and aligned with heart health. So remember, this is not a recipe. It's just inspiration that you can use immediately. It's an immediate takeaway from this podcast, other than the great information that, I'm talking about. So the Great Eats, one meal, 4 ways. Here's this week's focus. It's a snap-friendly Nourish bowl. AC's talking about these bowls because it's just so easy to throw things together. The deconstruction of it all, you make it your way with fresh ingredients. Okay. So for my blood type O's, brown rice or greens, ground turkey, sauteed broccoli and onions, and some olive oil to bring it all together. Okay. My blood type A's, get you some quinoa, some lentils, roasted veggies, fresh herbs, and some extra virgin olive oil. Or even avocado. Okay. Then my blood type B's, try some brown rice, some lamb, and leafy greens. And then to bring it all together, my type AB's with quinoa, get you some cod or some grouper. Okay. That's a great fish, great meaty fish, and mixed greens and some light olive oil as a drizzle. And of course, all 4 of these meals based on blood type can be just added and amped up with abstract spice. Okay. So remember, affordable, flexible, and heart supportive are all of these meal ideas in this Great Eat segment, in every Great Eat segment. And this is how policy shifts can become practical nourishment. Okay. We changed the narrative. We shifted it. So before you go, if today's episode supported you in any way, I want you to be sure to subscribe to the Abstract Blood Type Wellness Podcast so you can never, ever, ever, ever miss a grounded real-life wellness conversation. And if you're ready to go even a little bit deeper, I implore you to visit acrtofood.com and to start with one of our culinary health assessments available right on our homepage for you to complete. You can either go on the homepage, and there's also now a tab, the blood type wellness one-on-one kits. If you go up under that tab, you will see where you can actually complete your free blood type wellness assessment there as well. Okay. And remember, we are now HSA approved. That means that you can use your medical tax saver funds for the pre-tax saving funds for our programs, our memberships, and many of our other products and services that we have on ACR to Food, where you can explore the Blood Type Wellness one-on-one starter kits, our wellness coaching and memberships, custom meal plans and healing custom wellness tea blends, and one, if not all, of our 7 deliciously healing wellness ebooks and e-cookbooks. And of course, our flagship baby that started it all, our heart healthy, lower sodium, handcrafted, small batched Abstract Spice Gold seasoning blends that absolutely make everything taste so good and good for you. So remember, guys, restriction doesn't have to mean deprivation. With education, it can become opportunity. And until next time, great eats and healthy living.